Hi, my name is Joyce Thomas. I want to tell you about the RN Coder Network and our RN Coder ICD10 program that we've taught since 2012. It is the nation's only continuing education program to teach nurses, physicians, physical therapists, any clinical provider who needs to or wants to learn ICD10 can take our online program. And literally in a matter of 2 or 3 weeks, they will have their training. And if they choose to go for certification, we advise them to go to the American Association of Clinical Coders and Auditors, that's aacca.net, because it is the only organization that is testing and certifying clinical personnel in correct coding, ICD-10, documentation reviews, and CDI. The ICD-10 program implementation is slated again for October 1st, 2015. Some of you know that we've been in a holding pattern for another year, but I think that since the AMA and CMS has made peace with each other within the last few weeks, I think that we're going to go. We'll see. However, one thing is for sure, ICD-10 is a more clinically sophisticated program that requires, the coding requires more specific documentation for medical necessity. It requires a sophisticated knowledge of anatomy, physiology, pharmacology, pathophysiology, and medical terminology. In essence, that's an RN. So when you realize what's at stake here, RN Coder Network started in 2001 in response to Medicare's change in how it pays for all outpatient services. And they implemented the CPT codes on a specific packaged fee schedule called the Outpatient Prospective Payment System. And some of you who were in care that, in nursing care in those days, will remember how chaotic it was for a while. We lost emergency rooms because of it. I'm not kidding. And that because it's outpatient. So when you realize what's at stake here is that our entire U.S. healthcare system is going to have to change dramatically. We're going to have to get a lot better at that documentation specificity. We're going to have to be really good at documenting medical necessity and linking our codes. Physicians have been required to link their codes for years. CPT code matched with a specific diagnosis code for correct payment. Better get used to it. We're going to have to do it again, because otherwise there's not going to be any way to document what our payment should be going forward. So I want you to know that my background is as a healthcare administrator. I'm also a certified professional midwife. I've had my own midwifery practice for the last several years. But as a healthcare administrator, I understand very clearly what needs to be documented, what needs to be coded, what needs to be modified. And in the inpatient environment, you are really going to have to understand clearly and document your patients' comorbidities, their manifestations of their chronic disease, their complications, if they have any. And it's going to be an ongoing challenge to make sure everything is coded, because what you're creating starting October 1st is your fee profile going forward. So I appreciate you coming to my website today. I would love to have you in class. We do test preps in Las Vegas several times a year, but you can complete the whole thing online, including your certification testing. You do not need to travel at all these days. So please call our toll-free number, which is 855-987-6268. But for some additional information, go to rn-coding.com, and that will get you to the right place for additional information. Thank you for tuning in to RN Coding Network. Bye-bye.